Michelle Mannering was eagerly waiting for surgery next week to treat a precancerous condition, but the procedure has now been postponed indefinitely.
My worry is, first of all, is it going to get worse?
Mannering is frustrated with those refusing COVID vaccines and placing a heavy burden on hospitals.
I'm speaking to you, person who's unvaccinated. You could have stopped this. Somebody who really needs that surgery is denied it because these beds are taken up by the unvaccinated.
As hospitals teeter, unvaccinated people are overrepresented in critical care wards.
You do see the situation where somebody's unvaccinated and say, that was potentially preventable. And that's where there is frustration and frankly some sadness.
Addressing the crisis, Canada's Minister of Health weighed in on mandatory vaccination laws, saying he thinks provincial and territorial governments will eventually be forced to consider the idea.
What will make us move through this crisis and end it is vaccination.
But in Alberta, it's a non-starter. Premier Jason Kenney tweeting Alberta's legislature removed the power of mandatory vaccination from the Public Health Act last year and will not revisit that decision, period. Saskatchewan Premier Scott Moe wrote, "This is a personal choice, not one imposed on you by the government." Mandatory vaccination laws do exist in some European countries, but those rules are problematic, says this bioethicist.
I worry that turning this into a massive power struggle is probably going to make things worse rather than better.
As Omicron's onslaught continues, pleas to the unvaccinated are growing louder.
If you are an unvaccinated adult, you are going to become part of the Omicron wave that is threatening our hospitals.
Mannering fears a long wait before she knows when her surgery will be.
I just hope that somewhere there's some kind of awakening that people can understand that the vaccines are working.
And Ellen, what more did the federal health minister have to say?
Well, Ian, Minister Duclos said that COVID is going to require longer-term management, perhaps, he said, over many years. That's why he's saying, in his view, provinces and territories may have little choice but to eventually consider measures like mandatory vaccination, because the health minister said this wave shows that even when we have a high vaccination rate overall, a small unvaccinated minority can cause this intense pressure we're seeing on so many hospitals across the country.
Thanks, Ellen.